begin to do the ELS.
No, it's the same.
So it's a draw. We've got to say it's safe. We're going to look around and say no danger, right? And we're going to say, yo, Raj! Yo, Raj! No response.
Verbal and physical.
Yeah, so
It will be not good.
no?
So we begin to just shake the shoulders gently, okay? Gently.
No.
No
Yo, Raj!
answer.
No, he's not okay.
No answer after.
So basically then we've got to call an ambulance.
Yes.
So I've got to say, you, call an ambulance.
What is that first help? Check the
Shout,
breeze.
yes, shout for help, shout for
Help.
help.
Help? Help?
Anyone call the ambulance? We
Anyone?
can get it together naturally.
Nobody.
Yes?
Old jerks.
Of course. She don't.
And then?
Then?
When I start CPR.
No.
Like this.
It's not
Check
because
the
Breathing. Breathing.
check the breathing. Open the airway. Open the airway.
Tilt the head back.
Yeah, and after?
Look at the chest while hearing it.
How long?
Just a few seconds. Like 5 seconds.
10 seconds.
10 seconds. No. Nothing.
Fast, no breathing.
No. Pulse, no breathing.
Start the CPR.
Yeah. So we can do it through the nose or the mouth.
First make the chest compressions.
Okay. So I did 30. Right.
So first, like, check the breeze and then call ambulance. So we're gonna
After, when you examine for your victim is unconscious, then it's a danger situation for the victim. After you need to shout for help, call the ambulance. And if you can repeat the calling after when you examine the vital signs, it's good for us. It's good information for ambulance. But because of this, don't late with the CPR.
So in the test, should we first check the breathe, then ambulance, or first ambulance, then check the breathe?
You usually after when he's unconscious, shout for help. After, open the airway, check the breathing, check the pulse. Again, ambulance if it's possible, and start the CPR. Okay. How many compressions?
So we're going to do 30 compressions.
Yes.
2 breaths. Yeah, and then 2 breaths. And then continue on this.
How long? You continue?
Until exhaustion.
30 compressions.
30 compressions.
2 minutes continuously. It means 4 or 5 rounds.
Yeah.
So 2 minutes continuously. After 2 minutes, try to change with anyone because layer can make effective the CPR for 2 minutes. If can't change, then continue until ambulance will arrive, until the patient show any sign of life, will move or open the eyes, will scream for what are you doing, or you comes to be exhausted. Just in these 3 cases you can stop the CPR. Okay. Good. Next. Next.
What do you do next, or who's next?
So first we have to check the
First, check the environment.
check the environment, no danger.
Now, every time I do this done, I'll be sure somebody's doing CPR for puppet. That's what I'm going to do.
And then help, someone can call an ambulance. Then if he's breathing or not.
First, open the airway. Open the airway. Lift chin. How do you open the airway? What is the easiest maneuver to open the airway? Head tilt, chin lift maneuver. Yeah. So because here is the questions: airway management with equipments and airway maintaining without equipments. Airway maintaining with equipment.
Trocar, you can use a trocar.
First without, okay? First without. What is the easiest airway maneuver? The head tilt, chin lift maneuver. Okay.
That's without
Except which case we can't do, which cause we can't do.
If there's
Spinal cord injury or
neck
something.
injury.
The spinal bone injury suspected. In that case, how we open the airway? the jaw thrust maneuver, remember? Upward, forward, we move or subluxate the victim's mandible. Okay. After, if your victim is unconscious, but has pulse and has breathing, then how we open the airway and maintain the airway open until help will arrive. What's the name of the position? What is the name of the position?
If the patient is conscious or not?
Unconscious, has pulse, has breathing.
Stable side look.
Stable, huh?
Stable side look.
It's the recovery position. Recovery position. Okay, so without equipment, hands tilt, chin lift, jaw thrust, or recovery position. Which case we can't perform the recovery position? Which causes? You know? Spinal bone injury, and suspected, yeah. Rib broken, pelvic broken, double femur broken, and open abdominal injuries. Okay, in these cases you can't perform the recovery position. Good. Do you know the recovery position? Do you remember? Okay. With equipment, the easiest, open and maintain the airway. Who is the highest level? Nasopharyngeal or pharyngeal tubes, something. I think my colleague told it, 100%. Do you remember this? Or you need to choose the good size of oropharyngeal or nasopharyngeal tubes.
It's called a trocar, we call it in Hebrew.
This is the
Trocar, no? How do you call it?
is the oropharyngeal tube.
Okay, fine.
Oropharyngeal tube will elevate the tongue, or remove the tongue from back wall of the pharynx. This is the point of the oropharyngeal and even the nasopharyngeal tubes too. Okay, so elevate or remove the tongue from back wall of the pharynx. You take it to the victim's mouth. The nasopharyngeal tubes again the same, just it's longer. After, with equipment, we can ventilate the victim too with that maneuver. Is the Ruben balloon. Ruben balloon. Yeah. After, laryngeal mask, different size laryngeal mask. Is the part of blind insertion.
You mean the airbag?
Airbag is the Ruben balloon is the airbag. The laryngeal mask is a blind insertion equipment for open the airway. We discussed the airway maintaining maneuvers with and without equipment. Okay, and the highest level, endotracheal intubation. Endotracheal intubation. What is the danger of laryngeal mask? Why is it dangerous? Yeah. It is just one cause why it can be dangerous to use the laryngeal mask. Because it doesn't protect against of aspiration as the endotracheal intubation. So the laryngeal mask is good. We can insert blind to the victim without laryngoscope. Needed to know the endotracheal intubation, just doesn't protect against of aspiration as the endotracheal intubation. Okay? Excuse me, but can you give back the titles? I don't remember. Topic, please. Intravenous techniques. Can we repeat this because half of us was